Hello friends, welcome to the healthcare today. So the last episode we discussed about the fatty liver and fatty liver disease, and we understood what is fatty liver disease, where you have abnormal liver function test in the blood, ultrasound showing the liver is enlarged and swollen, or you may have abnormal fibroscan reports. We also understood the symptomatology of the fatty liver disease, what type of symptoms you may have when you are having fatty liver disease. So briefly, one is the obesity or the overweight. Second, if you are having some processed food or outside oily food. Third, where you are having any comorbid conditions like type 2 diabetes, blood pressure, hypertension, cholesterol, PCOD, or any family history. Today we will be discussing about the stages of fatty liver disease, where it is very important to understand the fibrosis or the scarring of the liver. As we all know, so fibrosis means there is scarring of the liver tissue, and we understand that there are 4 stages of fatty liver: first, second, third, and fourth. So if the person is having F1, F2, F3, F4 fibrosis, almost 30% of the cases we have seen that there are no symptoms, no clinical symptoms, apart from very mild symptoms like fatigue, easy fatiguability, nausea, vomiting, loss of appetite, abdominal fullness, and then there may be some warning signs like hyperpigmentation on the nape of the neck, hyperpigmentation on the knuckles of the fingers. There may be skin hyperpigmentation, the skin may be rough and thickened. So these are the things which we can say that the patient may have fibrosis. Now coming to the later stage of the fibrosis, that is the F4 stage, where we already know that it is cirrhosis or the end stage liver disease. The patient may develop complications once almost 70 to 80% of the liver is damaged. The patient start having the decompensating events. Decompensating events means the patient may have jaundice, he may have ascites. Ascites means he may have abdominal water. Third, he may have blood in vomitus, or fourth, he may develop hepatic coma. So in these conditions where the patient develop decompensating events, we counsel the patient or the attendant to get for a liver transplant. In those many of the cases we have seen that there is no liver transplant donor, so we try to prolong the same liver as far as possible. For as far as the jaundice is concerned, we have good number of medicines. We try to have the regenerative therapies to stimulate the stem cells. We try for the plasma exchange, we try for the steroid therapies. In case of ascites, where he develops water, we start with salt restriction diet initially, albumin therapies, water pills, or other measures as well. When the patient develops portal hypertension, or the blood or the patient develops pressure in the abdomen causing variceal bleed, where he develops blood in the vomiters, we try to do endoscopy and banding of the varices, that is the veins which are dilated inside the body in the stomach. Or he may develop, we may plan for glue therapies or the angiography embolization as well. In cases of hepatic coma, we start with anti-ammonia measures or try to block a larger veins. So these are the very small and very important things. We try to prolong the liver as far as possible, but definitely we have to understand that in cirrhosis or the end stage liver disease, the liver transplant is the sole option. Definitely we try to have to understand to prevent ourselves, to prevent somebody to getting into the stage of fibrosis and later into end stage liver disease. We have to curtail, we have to stop the primary prevention that we have understood the last episode. In the later episode, we will be discussing about the complications which we have discussed today, and how to what medications, what are the nutrition therapies a person having cirrhosis or the later stages should have, so that his liver or her liver can prolong. Thank you. We care for you.